What combinations may be useful to overcome the resistance that is acquired or upfront refractory patients, either to IO therapy or to a combination of anti-VEGF and IO therapy? And lenvatinib and pembrolizumab is a second-line therapy that was discussed and presented at GU ASCO, which showed a fairly decent response rate in this setting with a repeat IO along with lenvatinib, which is, as has been mentioned, is a multi-targeted tyrosine kinase inhibitor with anti-VEGF activity as well as FGFR inhibition activity. So that is definitely a regimen to be following along, and chances are, the same regimen is also being tested in the frontline setting, so more to come, and stay tuned on that. The other interesting regimen is a combination of cabozantinib with atezolizumab, a PD-L1 inhibitor. This combination of cabozantinib with IO has shown remarkable efficacy also, predominantly in the frontline setting so far, but now is being also tested in the second line setting in a randomized setting with cabozantinib plus minus atezolizumab. The other types of agents that are being looked at, of course, novel targets such as glutaminase inhibitors. CB839 is currently in clinical trials, has completed the clinical trial in second-line therapy of cabozantinib plus minus CB839 in advanced kidney cancer. And, the results are awaited at present time, but preliminary data does show that there is efficacy, as was seen in the Entrata trial with everolimus plus minus CB839. The combination had an improved progression-free survival. So more to come on these second, third line setting. Novel targets are being explored, and repeating IO-based regimen with combinations with VEGF TKI are also being explored.
So, Olga, I think that was a great summary, and I really do hope that these combinations will be more active in the second, third line settings. I think as we see frontline combination as axitinib based with pembrolizumab or with avelumab, hopefully there will be other broadening out the targets with lenvatinib and FGFR directed therapies, or with cabozantinib and MET and AXL. These may have other immunomodulatory behavior and may be more synergistic with immunotherapies in potentially the early refractory setting in either the second or third line. And I'm very hopeful about both of these trials.